Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, may peace be upon us all, and greetings are with you. Good morning, good afternoon, and good evening, Mr. Hassan and friends. Okay, so before we start our presentation, I want to ask you a question. Who is avocados here? It is not necessarily avocado as fruit, but Billie Eilish fan-based name. I mean, if you love pop electro or indie pop, you'll know her at least for once. She's very talented, yet still has flaws. One of her flaws that commonly occurs in articles and news is about her Tourette Syndrome. Okay, so now what is Tourette Syndrome? Have any of you heard about Tourette Syndrome? Is it dangerous, bothering, or is it just a common disease? Well, we will talk about that in this video. Before that, we are from Group 5 consisting of Shella Ayu Putri Kianawati, Sofita Dwi Raisya, Stefani Rena Sidarta, Shiva Dwi Rahayu, Sani Hasta Kamila, and Yumna Fadila Dewanti. We're majoring in psychology at Universitas 11 Maret right now, and calm down everyone, even though we're just first semester students of psychology, we will try to give you credible information from resources that we'll found such as related articles, journals, books, and so on that can give us the related and credible information.
Okay, what is Tourette syndrome? Tourette is a condition of the nervous system that causes people to have tics or sudden and unconscious twitches, movement, or sound that people do repeatedly. Other than that, we will don't just talk about the definition, but the cause, the types, the symptom, even the treatment of it too. So, our content will contain information about the definition of Tourette syndrome, the cause of Tourette syndrome, the types of Tourette syndrome, the symptoms of Tourette syndrome, and lastly, the treatment of Tourette syndrome. Let's begin with the explanation of what Tourette syndrome is.
Do you know what Tourette syndrome is? The name Tourette syndrome is less popular among Indonesian people. Many people are still unfamiliar with this disease, even though this disease is often encountered, such as Billie Eilish and David Beckham suffering from this disease. So, in order to understand what Tourette syndrome is, let's talk about it. Next. Tourette syndrome is a condition of the nervous system. Tourette syndrome causes people to have tics. Tics are sudden twitches, movement, or sound that people do repeatedly. People who have tics cannot stop their body from doing these things. For example, a person might keep blinking over and over, or a person might make a grunting sound unwillingly. Having tics is a little bit like having hiccups. Even though you might not want to hiccup, your body does it anyway. Sometimes people can stop themselves from doing a certain tic for a while, but it's hard. Eventually, the person has to do the tic.
Okay, although we already know the definition of Tourette syndrome, we would like to inform you what cause of Tourette syndrome. Possible cause of Tourette syndrome was known for a time, and in that the process area and the circuit within the brain are still not completely identified. However, it is clear that the cause of Tourette syndrome is complex. It's made up of, first, is the genetic influence. In the vast majority of the case, when a single gene has been convincingly identified. Genetic factor Tourette syndrome seems to be an inherited condition, and boys are 3 times more likely to inherit the condition than girls. Second, streptococcal infection, the Streptococcus bacteria. One theory proposes that a particular infection may be responsible for the neurological change associated with Tourette syndrome. Third, neurochemical abnormalities, the chemical of the brain. Neurotransmitter seems to be metabolized differently in people with Tourette syndrome, especially the mood regulators dopamine and serotonin. Fourth, certain infection and a subgroup of patients. Fifth, pregnancy. Fifth, pregnancy and breath difficulty in some patients. Sixth, possibly a hormonal influence. And lastly, other disorder. Research are divided on whether or not Tourette syndrome is associated with other disorders such as ADHD and dyslexia and obsessive-compulsive behavior. Such disorders often appear together with Tourette syndrome. Next. Can be concluded to both functional and structural abnormalities appear to be present in the brain of people with Tourette syndrome, especially in the frontotemporal areas and basal ganglia, when compared with a group of healthy control. Next. Internal and external factor of Tourette syndrome. Although the risk factor of possible cause of Tourette syndrome current research show that genes as internal factor play an important role. Genetic studies have indicated that Tourette syndrome is inherited as a dominant gene, with about a 50% chance of parents passing by the gene on to their children. And then boys with the gene are 3 to 4 times more likely than girls to display symptoms of Tourette syndrome. And then Tourette syndrome can be triggered by abnormality in metabolism of a chemical in the brain called dopamine. Some research has shown that Tourette syndrome is a genetically complex disorder that likely occurs as a result of the effect of multiple genes interacting with other factors in the environment. Scientists are studying other possible external factors and environmental risk factors that might be contribute to Tourette syndrome. But additional research is needed to better understand this association. Smoking during pregnancy complication, low birth weight, infection. Research have found mixed results about whether certain children are more likely to develop this following infection.
Okay, so now we already know what causes Tourette syndrome, right? But did you know that Tourette syndrome has some types? If you don't, then I'll tell you now. Tic symptoms range from simple tics to complex tics. Tourette syndrome is associated with both simple and complex tics. Simple motor tics are restricted to a small group of muscles in the body, and simple vocal tics to small sounds including throat clearing or sniffing. Complex tics involve several muscle groups or purposeful movement including touching or sniffing objects as well as the use of words or phrases. The first type is motor tics. Motor tics are sudden and apparently uncontrollable movements. Motor tics are divided into two types. The first one is simple motor tics, such as rapid eye blinks or eye jerks, tongue movements, head twitches or head jerks, squatting and hopping, and the last one is shoulder shrugs. The second type is complex motor tics, such as facial grimacing, touching people or things, and the last one is inappropriate gesturing or gyrating movements. The second type is vocal tics. Vocal tics are also divided into two types. The first one is simple vocal tics, such as grunting, barking, hissing, sniffing, snorting, and throat clearing. The second type is complex vocal tics, such as repeating words or sentences, repeating what other people say, using inappropriate languages, and stuttering or stammering.
After knowing the definition, causes, and the type of Tourette's, now we will move into the symptoms of Tourette syndrome itself. Tourette syndrome has two types of the symptoms, shows as physical tic symptoms and vocal tic symptoms, which we will discuss in greater detail here. Next. Okay, the first one is physical tic symptoms. Physical tic symptoms are symptoms that are related to the physical condition of the sufferer, such as involuntary purposeless motor movement. It might involve different parts of the body, such as the face, neck, shoulders, trunk, or hands. And then eye rolling, grimacing, shoulder shrugging, shaking of the head or limbs, jumping, trailing, touching objects and other people, such as kissing, pinching, and nails, and then nose twitching and any excessively repeated movement. Next. The second one is vocal tic symptoms. Unlike the first one, vocal tics is about symptoms that make a sound or related to the sound or voice or vocal of the sufferer, such as grunting, throat clearing, whistling, coughing, tongue clicking, animal sound, saying random words and phrases, swearing, but actually, swearing is rare and only affect about 1 in 10 people with Tourette syndrome. And then repeating a sound, words, or even a phrase, barking, and any other sound that excessively repeated without consent or unconsciously. Next.
Okay, the next point we'd like to consider is the treatment of Tourette syndrome. There are two types of treatment for Tourette syndrome, such as treatment with medication and treatment with therapy. In addition to discussing the benefits of the treatment, we will also discuss the side effects of the treatment, which will be discussed in detail after this. Okay, the first one is the treatment with medication. Next. Okay, the treatment with medication. Medication to help control tics or reduce symptoms of related conditions include: number 1 is medication that block long-lasting dopamine. For example, fluphenazine and promazine or ORAP can help control tics. Possible side effects include weight gain and involuntary repetitive movements. Tetrabenazine or senazine might be recommended, although it may cause severe depression. Number 2 is botulinum or Botox injection. An injection into the fat muscle might help relieve a symptom of vocal tic. Number 3 is ADHD medications. Stimulants such as methylphenidate can help increase attention and concentration. However, for some people with Tourette syndrome, medication for ADHD can exacerbate tics. Number 4 is central adrenergic inhibitors. Medications such as clonidine and guanfacine, typically prescribed for high blood pressure, might help control behavioral symptoms such as impulse control problems and rage attacks. Side effects may include sleepiness. Number 5, antidepressant. Fluoxetine like Prozac, Sarafem, or other medicine might help control symptoms of sadness, anxiety, and OCD. And number 6 is anti-seizure medications. Recent studies suggest that some people with Tourette syndrome respond to topiramate or Topamax, which is used to treat epilepsy. Okay, next. Okay, the treatment of Tourette syndrome with therapy. Number 1 is behavior therapy. Cognitive behavioral intervention for tics, including habit reversal training, can help you monitor tics, identify premonitory urge, and learn to voluntarily move in a way that's incompatible with the tic. Number 2 is psychotherapy. In addition to helping you to cope with Tourette syndrome, psychotherapy can help with accompanying problems such as ADHD, obsessions, depression, or anxiety. And the last one is deep brain stimulation or DBS. For severe tic that does respond to other treatment, DBS might help. DBS involves implanting a battery-operated medical device in the brain to deliver electrical stimulation to target at the control movement. However, this treatment is still in the early research stage and needs more research to determine if it's safe and effective treatment for Tourette syndrome.
Well, we are already at the end of our presentation. We hope you can gain more information from our presentation. In conclusion, in short, the definition of Tourette syndrome is a bunch of tics that happen repeatedly. Tourette syndrome isn't dangerous, but sometimes can harm themselves or people who are near them at that time. And even though Tourette cannot be completely cured, we can still give them treatments so that they can control tics that interfere with everyday activity and functioning. Do you remember when we asked you whether you already know about Tourette syndrome or not? After hearing the explanation about Tourette syndrome, we would like to persuade all of you to get to know more about Tourette syndrome so that in the future we all know the causes and the type of Tourette syndrome, the symptoms of Tourette syndrome itself, and how to deal with it. We hope all of you can be more aware of Tourette syndrome, which we often meet in society. After our discussion earlier about Tourette syndrome, let's review a little bit. So, Tourette syndrome is a condition of the nervous system that cause people to have sudden twitches, movement, or sound that people do repeatedly that are called tics. Possible cause of these syndromes are so many, such as genetic influence, streptococcal infection, the Streptococcus bacteria, etc. Types of Tourette syndromes are motor tics and vocal tics. Each type is divided into two movements, simple tics and complex tics. The symptoms of Tourette syndrome are physical tics and vocal tics, and the last is the treatment that can be with medication or with therapy. Next, please. Okay, that brings us to the end of our presentation. Thank you for your kind attention. We really appreciate having had this opportunity to share our ideas with you. Goodbye.